Hello everyone. Now we are going to see about the three important organ systems and the diseases and the conditions that are associated with the pregnancy. So first let's start with the pyelonephritis. What is pyelonephritis? So here if you see we have the kidney and here we have the phylum. When this area, when the pyelo as well as the nephritis kidney both are affected, then it is known as pyelonephritis. We should know that pyelonephritis is much more common in pregnancy. Why? This is because in pregnancy we have increased progesterone. This increased progesterone will cause the ureteral stasis. It will decrease the peristalsis of the ureter. So when the ureteral stasis happens, when the peristalsis decreases, then the urine is not flushed as it is done in the normal person in pregnancy. Therefore, they are more prone for the bacteria to ascend to the kidneys and more prone to have pyelonephritis. So this is about progesterone. There is one more reason for the pyelonephritis, that is in pregnancy the fetus will compress the organ systems, and similarly it will also be compressing the ureter as well as the kidneys, thereby making the pyelonephritis much more common in pregnancy. So what is the treatment and what should we do about it? One should know that normally when they have asymptomatic bacteriuria in a normal person, in a non-pregnant female and in male, what should we do when there is an asymptomatic bacteriuria? That is, they have a bacteria in the urine but they have no symptoms of urinary tract infection, like they don't have any irritation, they don't have urgency, there is no symptoms at all. So will we treat a normal person with asymptomatic bacteriuria? No, treatment is not needed. But in pregnant women, if they have bacteriuria and it is asymptomatic, still we will be treating them. This should be the take home message. So with what will we treat them? The treatment is with nitrofurantoin. Nitrofurantoin is generally given for asymptomatic bacteriuria, given for cystitis, and it is also given for there is one more condition which I couldn't remember it immediately. UTI, obviously. Fine. Now what do we know about cholecystitis? In cholecystitis, what is it? When there is a stone in the gallbladder, that is known as cholecystitis. When the gallbladder is inflamed, that is itis, because of the stone being stuck in the cystic duct, then it is known as cholecystitis. So why should pregnant women be more prone for cholecystitis? This is because the first important reason is progesterone. The same reason as this. Progesterone will decrease the peristalsis and by increasing the biliary sludge. Therefore, the sludge in the gallbladder is increased and the sludge is more prone to become the stones. But here we have another additional factor. Estrogen is also increased in pregnancy. So that estrogen will upregulate the HMG-CoA reductase. So estrogen is upregulating HMG-CoA reductase. What will HMG-CoA reductase do? HMG-CoA reductase will increase the cholesterol formation. What does cholesterol do? The cholesterol will form cholesterol stones. Increased cholesterol will form cholesterol stones. Therefore, in cholecystitis, this because of increased progesterone as well as increased estrogen. So, how is the cholecystitis diagnosed? It is diagnosed cholecystitis as well as cholelithiasis is diagnosed with ultrasound. So, but what about the HIDA scan? What is the role of a HIDA scan? HIDA scan is something where this hydroxyindole acid is given to the patient via IV, and the uptake by the gallbladder and the emptying by the gallbladder, uptake by the liver and emptying by the liver is all visualized. So once this is given, the liver uptakes and we are able to see the entire biliary structures. After that, the bile should pass into the gallbladder, right? And similarly, the HIDA which is given, that component which we give the HIDA scan, that should also enter into the gallbladder. But if we have a cholelithiasis and cholecystitis, where the stone is obstructing the gallbladder mouth and the gallbladder itself is inflamed. The gallbladder cannot take up this component because it has been obstructed. There is no place for the component to go inside and for the gallbladder to be visualized. Therefore, in HIDA scan, the gallbladder will not be visualized because the stone is exactly present at the mouth of the gallbladder duct, and the gallbladder is also inflamed because of that. So, HIDA scan, if we have high suspicion for cholecystitis, then HIDA scan can be given. Now, if you ask me, will the HIDA scan be positive in cholelithiasis? What is cholelithiasis? When the gallbladder has a stone anywhere, that is even in the sludge if it is having a stone, but it is not obstructing the gallbladder and causing cholecystitis. Inflammation of the gallbladder hasn't set in yet. In that case, the HIDA scan uptake can happen because the mouth of the gallbladder is open and the HIDA scan can enter and it can and the gallbladder can be seen in the HIDA scan. Therefore, HIDA scan is very useful in cholecystitis. Okay. Now, what is the treatment? So, in cholecystitis in pregnancy, we have two kinds of treatment. So, first is the medical treatment where we use ursodiol as the treatment. The second one is surgery where laparoscopy can be done to remove the cholecystitis. Both of it as a treatment for cholecystitis. Now, let us come to the third most important condition, that is appendicitis. Where is generally appendicitis? Appendix inflammation, where will the pain be? The pain will be in the right lower quadrant pain. But since they are pregnant and the organ systems have to compromise as they are already housing a fetus, the appendix is also been shifted to the right upper quadrant. Therefore, appendicitis pain will be present as right upper quadrant pain. So, one should not confuse it. Even cholecystitis will also be having a right upper quadrant. Appendicitis will also be presenting with the right upper quadrant pain. So, what is the treatment? Laparoscopic appendicectomy is the treatment for appendicitis in pregnancy. So, with this we have finished the most common organ systems that have been affected in pregnancy. Have a good day.